Hello, everyone, and thank you for joining us. We are back here. My name is Megan Phillips of the Train with Trust Project, here with Jody Ambrose, my co-founder here at the Train with Trust Project. And we are joined once again with world-renowned equine orthopedist, veterinarian, Dr. Sue Dyson, to talk with you all about a very interesting topic that will hopefully feel really right at home for all of you. We're talking about the sense of rideability, the sense of rider feel, things that you might feel as you're riding your horse that can tell you something possibly about your horse's orthopedic health. So it's a very important topic because you all are the first line in understanding what's going on with your horse's health. So I'm going to be in the background showing photos as we go along and taking notes, taking questions. If you have any questions, go ahead and pop those in the chat. And with that, I'm going to turn things over to Jody Ambrose to lead this discussion with Dr. Sue Dyson.
Okay, I'm excited about this topic because I am at heart a dressage trainer and have been working over the last couple of decades at trying to help people understand horses better and their behavior better. And particularly in the last few years, there's been, I think, a lot of progress on understanding horses better, in large part thanks to Dr. Dyson and others. But one thing I have seen is that in a lot of cases, the pendulum has almost sometimes swung so far the other direction that where we used to blame horses for behavior issues, sometimes now it's a common thing for trainers to blame riders for things. And in some cases, in a lot of cases, now that we're recognizing pain in horses, we're realizing how often behavior issues come out of some sort of pain issue. And it's neither the horse or the rider that is at fault. It's something that we need to recognize and address. And so I'm excited to focus on this topic because what we're really going to get into is what it feels like when there's something going on in the horse as opposed to what it looks like. And one of the soapboxes that Dr. Dyson is on a lot of the time, and that I also try to emphasize with people is that it is really important to evaluate horses under saddle, not just on the end of the lunge line when you think there's something wrong. And so in addition to spotting the 24 behaviors and others that show up under saddle, this is another really critical piece that, as Megan said, we as the riders of our horses are the first line. We're the first ones to notice when something changes. And so I'm interested to hear what you have to say about the issue of rideability and what it feels like when something is right versus when something is maybe not right. So to get into that topic, let's start with that. I feel like we start a lot of our discussions this way, but let's talk about what constitutes normal performance in a healthy horse, and how should a normal, healthy horse feel when you're riding them?
Well, I think I have to describe what I've done in my life first to understand why I'm in the position to be able to talk about this. Because I became an equine veterinarian because I was a rider. And I was privileged enough to train several horses from novice level through to upper national level in both eventing and show jumping. And in doing so, I had the good fortune to work with a number of different trainers from whom I learned quite a lot. And I was fortunate that these horses were by and large non-lame horses. So through riding, I appreciated what a non-lame horse felt like and how they performed, how they responded progressively to training. And I also experienced a couple of horses that had musculoskeletal problems, and I realized how different they felt to ride, how they didn't progress in the same way through their training, and how their behavior at times would alter. So just by being a rider, I think I have felt what normal should feel like. And also as a rider combined with having been an equine veterinarian, I rode many clients' horses and knew the difference how they felt because they had problems compared with how non-lame horses felt. And then by using nerve blocks on those horses, we could take away their pain, and I would ride them again and feel an enormous difference in their rideability, their responsiveness to cues. And so I think for those reasons, I am somewhat qualified to talk about this. And I also have qualifications as a coach and historically did quite a lot of coaching. So I've watched a lot of horses from the ground and watched the way they have or have not progressed in their training, based again on whether or not the horse was experiencing discomfort. And I think that it is important to recognize that most of us learned to ride at riding schools, and therefore we were riding quiet and tolerant horses. But many of those horses actually had low-grade multi-limb lameness and therefore were not actually normal horses. And so I grew up with the convention that we had some lazy horses, some unwilling horses, some naughty horses, which I think are complete misnomers, because I think that they are like that because they've got underlying discomfort. And as a consequence of that, some people who are regularly riding now, they've progressed through the riding school, they've been horse owners for years, quite a lot of them actually will never have experienced what a normal horse feels like, which is why I think this topic is so important, to tell people what normality should be. And obviously that's going to depend somewhat on the stage of training of any individual horse. So a horse recently introduced to ridden work as a 3 or 4-year-old is going to feel very different to that the quality of paces of a more established horse. But I think the principal things that we should be aiming for, even when starting with the recently ridden 3-year-old, is that we're looking for willingness. We're looking for, depending upon the actual athleticism of the animal, it should still be wanting to go forwards. It should be responding to our cues. And then I think we need to talk, and I'm going to throw this back to you now, to talk about how horses should learn to respond to cues. So how do you think a horse should respond, or how do you teach it to respond to a leg cue to go forwards?
So basic learning theory is that an animal learns to associate one thing with another, and those the behavior that is the consequence of a cue is either reinforced or punished. So most often a horse learns through negative reinforcement, which is that pressure is applied, and then when the horse moves forward, that pressure is released, and they are reinforced by the subtraction. Negative isn't a value judgment, it's a mathematical term. And so a horse will move forward, which is the desired behavior, and then the stimulus is removed, and that reinforces the moving forward. So in theory, that's how they learn. There's other ways that they can learn as well. They can be positively reinforced by being given, adding something desirable that reinforces the behavior. And then of course they can be punished if they don't move forward, which is also something that happens in horse training. And if people understand those tools and you use them consistently, then they can be a little bit more confident that any resistance to moving forward or any other behavior is not because of the way that it's being trained, but because of maybe something underlying that makes it either not motivating enough or too difficult. I always say if a horse is physically capable of doing something, understands the thing that you want, and is provided sufficient motivation, they will do it 100% of the time. So those three factors are really important to consider. And when we talk about health issues, a lot of times it's they physically can't do something in a way that's comfortable.
So for me, a horse that is undergoing correct training and doesn't have any underlying problems is going to progressively learn to be instantly responsive to cues, be they leg cues or rein cues. And because they are responsive, they are going to do that willingly. And they're going to move in whichever pace they are in with a regular rhythm. The speed is not going to change. And they're going to move with a degree of animation and athleticism, which will be dependent upon the type of horse that it is. And it is my belief that any correctly trained horse, even a cob, should be able to perform walk, trot, canter on both diagonals, should be able to do easy transitions, should be able to trot in small diameter circles, 20 meters, 10 meters diameter. They should be able to move sideways willingly in leg yield, shoulder in, travers, renvers, half pass, and do simple changes. So canter, walk, canter. Not all horses are going to be able to progress beyond that stage because they don't necessarily have the inherent athleticism to do so. It would be like saying, well, can you run 500 meters? Some people can and some people can't. You may be able to train yourself to some extent, but some people are going to run with a greater deal of athleticism with less harm on their body than others. So the horse should all the time, if it's in the correct frame, be moving through its back. So the back will move up and down, it will move from side to side, and it will rotate slightly. And you should, as a rider, feel this movement underneath your back. And the movement of the horse's back should be a little bit like bouncing up and down on a trampoline or being on the crest of a wave. It should be soft and fluent, and you shouldn't receive a jarring impact through your back. And then that motion of the horse's back is reflected in the movement of the tail. So in a normal horse, the horse's tail should be erect and should swing from side to side, following the movement of the horse's back in whatever pace it's in. So we should also feel that the horse is taking symmetrical contact so that you have a similar feel in your left and right hands. So you shouldn't feel that the horse is much heavier in one hand than the other. The horse should take a contact, but it shouldn't be leaning on your hands. You should feel that that contact is something whereby you could still communicate. So if you took slightly more tension with your fingers on one hand, the horse would be responsive by flexing a little bit towards that side. So you feel that you've got communication through the horse's mouth rather than a mouth which is absolutely solid and you're not getting any response to movement of your hands. And then the horse should not be excessively tense. You should have this feeling of relaxation. Now, obviously the muscles have got to be active. So we're not talking about floppiness. We're talking about really lack of mental tension, lack of the horse feeling buzzy, lack of the feeling that as soon as I put a leg cue on, the horse is going to accelerate. So you've got the correct responsiveness rather than an exaggerated responsiveness. If I am in trot and I'm in rising trot, irrespective of the direction in which I'm going, if I change diagonal, the horse should feel exactly the same. And I shouldn't feel that I'm being thrown off one way or the other, or that the horse feels as though it's got a more jarring sensation through one hind limb compared with the other. And if I change back diagonal, again, I should feel that the horse feels underneath me pretty symmetrical. Now, I know that some riders have much better feel than others. Some are able to articulate what they're feeling, and others are not, because they've never really thought about it. And what I want to try and encourage people to do is think about what you're feeling and not necessarily blame things on yourself. So often I hear, oh, well, the horse hangs on my right hand, but my right hand is my dominant hand, so it's the effect of me. But I would say that if the horse is a normal horse and has been trained correctly, then you should have an even rein tension. Now, if you don't have an even rein tension, it doesn't necessarily mean you've got a lameness problem. It may be that there's a crack in the corner of the horse's mouth, or it may be that there's some sharp outer edges of the upper cheek teeth and they're being compressed against the inside lining of the cheek, and you've got some ulceration, which is causing discomfort. So we have to, if we don't have even rein tension, think about all the different reasons why that may be so. Now, some horses may have chosen to, for example, be a little bit too heavy on the right hand. And if that was the case, as a rider on a right circle, I would bend the horse to the outside of that circle. So ask it to take a greater contact on the left rein. And then I would straighten the horse and try and release my right hand. So I've used counterflexion to the outside and then made it straight and then released my right hand. And if the horse is properly trainable, then I should now have a relatively even rein contact. If I can't, by using counterflexion to make it take the left rein and then release the right rein, and then the horse immediately goes back to hanging on my right hand, that makes me think, this horse is not responding as it should do. There must be a reason for this. Maybe we could look at the first picture, Megan, of the horse in trot. So this is a horse in trot, and we can see that the horse looks expressive. It's carrying its tail nicely. Its ears are pricked and forward. It's looking like an animated, balanced trot. This is only a 5-year-old. It hasn't done a huge amount of work, but the whole picture is of reasonable balance. Let's now think a little bit about canter, and we'll go on to the next picture. Now, canter is, we're just this one. Stay on this one. So canter is a 3-beat gait followed by a period of suspension with all 4 limbs off the ground, which is what you're seeing here. So canter should feel to you as though the hind limbs are providing propulsion. And we've got that nice swing through the horse's back. And you feel as though your pelvis is being rocked backwards and forwards in rhythm with the canter. And you're still an even rein tension in your left and right hands. And the horse is willing to do a transition from trot to canter, and also is sufficiently well balanced to do a transition from canter to trot. Now, obviously, this is going to depend on the stage of training, because a young horse is going to be more on the forehand than a more established horse, but this is what we're aiming for. And this period of suspension, I think, is really important, because I think that this is something that lots of people haven't actually experienced, either because they don't ride the horse forwards enough, or because the horse has got an underlying problem. Because if there's an underlying problem, the horse doesn't want to push off sufficiently to have all 4 limbs off the ground. And it's going to want to get to its feet to the ground pretty quickly so that there's less concussion on the limbs. So it won't get as elevated off the ground. But this is a horse. It's only competing at novice level. And this is, I think, a lovely picture with the rider well in balance. The horse's expression speaks for itself. It's got an engaged eye. Its ears are forward. There's even rein tension. The mouth is shut. There's a nice length of the neck. The head is slightly in front of the vertical, and the tail is swinging. So I think that this is what we should be aiming for when we're looking at a pain-free horse, and this will feel good. So I think that a normal horse should feel pretty similar on the left and right reins in both walk, trot, and canter. Now, as you progress from training the 3-year-old upwards, for sure, they're going to find some things on the left rein easier for a while. And then as you go through training, it may become more symmetrical, and then it finds something a little bit more difficult on the right rein. But then it goes back to feeling pretty similar on both reins. And that's just a natural progression. And I wouldn't worry terribly about that. I only start to worry when consistently things are worse on one rein than the other in terms of what you feel, the horse's willingness, the horse's responsiveness to the cues. And I always say the horse should be responding to those light cues. If you are having to use excessively strong cues, you need to be asking, why? Why can I not easily slightly slow this horse down in preparation for doing something different? So why is the horse not responding to a half halt? Why do I suddenly feel that the horse is going against my hand, it's pulling against my hand? Because it shouldn't do that. I think that when horses are learning new movements, they can sometimes get a little bit confused because they're not really sure what you're asking it to do. But you need to be clear in your cues. If the horse doesn't respond, you need to try that exercise again, and hopefully it will make an attempt to do what you ask. And then you reward it. You reward it by scratching its neck. You reward it by letting it walk on a long rein for a little bit. You may even want to positively give it a low fiber treat to it, so it acknowledges that it's doing the right thing. So the normal horse should be making progressive improvement. And I think throughout any work, be it packing along a country lane, cantering down a grass track, riding in an arena, we always need to be sense checking and asking, is the horse feeling good for me? Does my body feel good? Because if I feel that the horse is moving me so that I'm not sitting symmetrically, and I've done my best to readjust myself and made myself concentrate on sitting symmetrically, the normal horse should keep you in that symmetrical position. And if you can't maintain that symmetrical position, either you've got a problem, which is a possibility, or your horse has got a problem, and you need to be thinking about this. And I think that riders sometimes underestimate their role in the horse-rider combination. As a rider, I think you are part of an athletic combination, and you need to be balanced and in the correct posture and be able to move as well as possible in synchrony with the horse. And that's your responsibility as a rider, because if you are not sitting symmetrically, then the horse is going to adapt its movement postures to accommodate you, and that could ultimately result in the long term in the horse developing lameness because it has altered its movement patterns. I like to feel how a horse adapts to me being in rising trot versus sitting trot, assuming that I can sit in balance and that my pelvis is moving appropriately, so I am absorbing the concussive forces that are being generated by the horse's back through the saddle to me, then the horse should maintain the same rhythm, the same speed, and the same overall outline when I go into sitting trot compared with rising trot. And that should be a consistent feature. And if it's not a consistent feature, we have to ask why. Is it because I am not sitting straight? Is it that I cannot absorb the movement of the horse through my body because my body is not functioning optimally? Or is it because the horse is uncomfortable? Bearing in mind that it might be discomfort caused by the saddle, not necessarily a problem with the horse itself. In my experience, horses should be able to turn easily to the left and to the right with equal ease. And if the horse is consistently more difficult to turn in one direction, so it can turn easily to the left, but it's more difficult to turn to the right consistently, then that indicates that something's not right. And finally, I think we're almost at the end of the flat work bit, but then we're going to talk a little bit about jumping. In flat work, I think a normal horse, even relatively early in its training, should be able to be ridden in a 10-meter diameter circle in rising trot. And I think that this is a very good test. The horse should maintain the same frame. It should maintain the same rhythm. It should maintain the same fluidity of movement. And if it doesn't, it's highlighting that there may be a bit of a problem. So shall we move on to jumping a little bit? So if we go to the next photograph, we're going to see the horse on an approach to the fence, a fence. And the horse's body posture changes on the approach to a fence. And most horses will raise their heads. So if we just go back one, so we're on the approach stride. Here the horse has raised its head. The rider is beautifully in balance. The horse's hind limbs are coming underneath the body before the horse is going to make a strut with its front limbs in order to push off the ground. So this horse is looking to the fence. Its eyes are focused. The rider's eyes are focused. And this is a nice picture. And then we go to, and so you as a rider will feel the horse's head and neck come up. The horse may be a little bit stronger in your hand if it's keen to jump and it enjoys jumping, but it shouldn't be accelerating too much. If it's accelerating too much, that means that either you've got a training problem, or it may be because the horse is anxious about jumping and therefore it's almost running away from you. But if it's beginning to jump, it may be frightened by the fence. So we may be having to start very, very small to gain the horse's confidence and trust in us. And I always think with any form of training, our aims are to create trust and confidence with the horse so that the horse trusts us. The horse trusts us and is given confidence that it knows that it's never going to be asked to do something that it is not capable of doing. And with progressive training and appropriate training, I think that this can be achieved. And I wouldn't worry if when we're beginning jumping, the horse wants to wiggle going into a very, very small fence because it's apprehensive and it's not truly following your leg cues. But if it then jumps the fence, it may balloon over the fence. We have to be very careful that we allow the horse to do that, and we don't give it negative reinforcement by jagging the horse in the mouth when it's done exactly what we wanted it to do. But assuming that we've given it a nice time, then next time round it comes with a little bit more confidence. Third time round it comes with even greater confidence. So we're making progressive improvement, and then we walk a bit and say, that was a good job, great. So let's look at the next photograph, which is going to be the takeoff. So the horse has pushed off with the strutted forelimbs, and now it's pushing off with the hind limbs. Some horses will place their hind limbs absolutely side by side at takeoff. Others, as with this horse, will have one hind limb slightly behind the other. That doesn't matter. The normal horse will push off symmetrically with both hind limbs so that in its trajectory over the fence, it jumps straight. If the horse is constantly jumping, veering off, for example, to the right, that generally means that it's been pushing more with the left hind limb at takeoff than the right hind limb, which is probably because the right hind limb is not as strong or is experiencing discomfort. So the normal horse should push off symmetrically on from both hind limbs. And you should feel that there's a certain amount of power being generated. Now, obviously, some horses are much more talented at jumping than others, but most horses should be able to be trained that they can jump round a course of fences at 80 or 90 centimetres with relative ease. So let's take the next photograph, which I think is the landing. So on landing, the horse should feel as though it wants to move away from the fence relatively easily. Ideally, if it's a trained horse, it should land with the correct forelimb leading, so that if you're going to be turning to the right, you have used your leg cues to encourage the horse to land with the correct limb leading. Now, obviously, we make mistakes as riders, horses make mistakes, but if the horse consistently lands with the incorrect forelimb leading, then that usually is a reflection of an underlying problem. So we have recently completed a study when we observed the behaviors of 805 horses that I think did not have musculoskeletal pain. So these are what I regarded as clinically normal horses. These horses were all evaluated in competition, so it wasn't possible to assess saddle fit and bridle fit. It was not possible to evaluate their mouths to determine whether or not they had any oral lesions. But I think that nonetheless, the observations are important for either the rider feeling how the horse is going or someone watching how the horse is going. So in those normal horses, the horse's head was still and it was in a straight position without repeatedly tilting its head to one side. The front of the head was either in a vertical position or behind the vertical position throughout the work. The horse's eyes were open and the horse had an engaged expression. There was no exposure of the white of the eye, and the horse's mouth remained closed for most of the time with no exposure of the tongue. And the bit was held in a symmetrical position in the horse's mouth. And one would assume that the riders probably had a reasonably symmetrical rein tension as a consequence. The tail was held straight rather than crooked, and although there may have been an occasional tail swish when a leg cue was applied, this was not on a repeated basis. These horses maintained a regular rhythm and speed in trot and canter. When worked on the flat, they struck off into canter with the correct limb leading, and they did not change legs behind. Now, it was important to recognize that these were horses performing in competition, and I do think that there are some young horses, when they are learning ridden canter, that will become disunited within an arena, around the short sides of an arena, or if asked to do big circles in canter, because they have to learn how to balance themselves. But those horses, if they were cantered in a straight line, should maintain a correct canter and not become disunited. So these horses responded to the rider's cues willingly. They did not change speed spontaneously. They did not change in their gait. They didn't break from canter to trot, for example. They did not trip behind or in front, nor did they have a bilateral hind limb toe drag. And there was no spooking. The horses responded to the rider's cues and moved in the direction in which the rider wanted them to. And there was an absence of either bucking or kicking, or rearing, I should say. So these are the behaviors that, or the way in which I would expect a normal horse to go under most circumstances. But I'm fully acceptant that if the rider makes a mistake, the horse may react by saying, oh, I didn't understand that. And it may put its ears back. It may swish its tail. It may not be as responsive as you wanted it to be. But with appropriate training, that should improve progressively. I then think we need to think about what the horse does to the rider. And perhaps we can move to the next picture. And I want you to look at the rider's posture. This is a horse being ridden in rising trots. And we've captured pretty much the same phase in the stride in the left-hand photograph versus the right-hand photograph. And if you compare the rider's posture in the left photograph when she's wearing green, you can see that her upper body is slightly tilted forwards and her left hand is slightly higher than her right hand. Whereas in the picture on the right, when the rider is in black and dark blue, we can see that her upper body is more erect and she has a more symmetrical hand position. Now, this change in the rider's posture has been induced by the horse. The horse in the picture on the left has front foot pain. And in the picture on the right, I have taken away the front foot pain by nerve blocking the feet. And as a consequence, the horse has changed its posture. So in the picture on the right, the neck frame is slightly longer. The horse's head is in a more vertical position. The rider has got a longer rein, you can see. There's a bigger forelimb step length, and the horse is stepping under better from behind. So the right hind leg is more close to the position of the right forelimb in the picture to the right compared with the left. So this change in the rider's posture has been induced by the improvement in this horse's gait. We didn't ask the rider to do anything different. This is what the horse has done to the rider. So if you feel that you are being put out of your ideal position, then you have to think, why? Is it something I'm doing? Is it the way I'm positioned by the fit of the saddle to me? Or is it something that the horse is inducing me to do? And in this instance, the rider's position and also what she felt underneath her was very different in the photograph on the right, where the horse is effectively normal, compared to the picture on the left. And I think people don't really appreciate how much influence a horse working with low-grade discomfort can have on the posture of the rider. So let's just think about canter and go on to the next picture. And here we can see that this is not a very good canter. Why do I say it's not a very good canter? Well, there's not a suspension phase. These are a series of photographs. There's no suspension in this canter. The horse's head is way behind the vertical. And in the picture on the right, we can see the way the horse is overloading the forehand. So this is a poor quality canter. And the poor quality canter is inducing the rider to move her upper body backwards and forwards. So although the rider's upper body position is erect on the far left and the middle photographs, the horse, because it's on the forehand in the picture on the right, is inducing the rider to tip her upper body backwards. That is being entirely induced by the horse. And if we move to the final picture, we see a more exaggerated effect of this. When, if you compare the rider's posture on the left, when the horse is initiating canter with the trailing right hind limb, compared with when it's should be about to have a period of suspension on the right, because the horse is overloading the forehand, it is immediately tipping the rider backwards. And that shouldn't happen. So if you feel that you are being tipped backwards and forwards, it's usually because either the training is wrong, you haven't been able to engage the hind limbs properly, you haven't been able to develop the muscles of the thoracic sling, enabling the horse to lift the forehand, or there's an underlying pain problem in the horse. So I think that's a kind of general overview of what a normal horse should feel like. And I think it's a wonderful thing when you feel this true harmony between the horse and the rider, because the horse is normal. It's an almost magical feel. You can almost think what you want the horse to do, and the horse responds. And that's really epitomizes to me true horsemanship and a partnership that reflects that the horse is pain-free and it's learning its job.
Well, I feel like that was very comprehensive in terms of explaining how rider feel shows up when horses have issues. Are there specific soundness issues that you immediately, because obviously there's a process of peeling apart what's the horse, what's the rider, and it's not always all one or the other, right? So,
right.
So this whole sort of process of pulling it apart and figuring it out is, I think, one of the more fascinating and more frustrating things for people to work through. Are there certain issues that when you hear of like a specific, someone comes to you and mentions a specific issue, are there certain things that are that jump out at you as being able to separate this is a horse problem versus a rider problem?
Well, I will always ask, how did the horse feel before? Because if the horse is going backwards in its training, there has to be an underlying reason for that. That's likely to be either the tack or the horse, as most likely. It's not likely to be you. If the horse used to be able to do something with you and it's now struggling to do that, that highlights the presence of a problem. Now, some people like to say, oh, well, my horse is a slow developer, so I've given it time. And then I ask, well, how long have you had the horse and how long have you been training it for? For me, horses should be improving relatively rapidly in their training, assuming we're doing a decent job. So if they say, well, I've been struggling with the canter strike off on the correct lead for the last year, is not uncommon. I think, well, that's not right, because a horse should be able to learn how to canter with the correct lead relatively quickly. And yes, some horses are quicker learners than others. Yes, some horses develop more skeletal maturity and strength earlier than others. But whatever your starting point is, you should be seeing progressive improvement.
Mm-hmm.
assuming that you are riding reasonably, the saddle fits the horse, the bridle fits the horse, and you have some idea about how to train a horse.
Mm-hmm.
And if you're not making progress, then something's wrong, and we have to find out what is wrong.
Mm-hmm. So that brings up an interesting question that I've experienced in my past, which is if a horse will perform better for a trainer versus a student, or one rider versus the other, does that necessarily mean that it is a rider issue, or could that still be a pain issue that one rider is better at working through than the other?
Well, I think I learned this the hard way. And I learned this the hard way as kind of, you think I'm a rider. And if I can get on the client's horse and make it go better, well, of course, it's the rider's problem, not the horse. But I don't think that's always the case.
Right.
Yes, as a better rider, you can make the horse go better, but that doesn't necessarily preclude that the horse may have an underlying problem. Now, sometimes I think we need to look back and ask, has the horse been asked to do the right thing, and does the horse have confidence in the rider? So I've been in a situation where I've been asked to ride a horse which has been constantly stopping with the normal rider. And the rider has lost confidence in herself. The horse has lost confidence in the rider. And that's not a good scenario.
Right.
I would approach the jump, and the horse may put on the brakes. And that's a circumstance when I may immediately either kick the horse or hit the horse once, very, very quickly. And the timing is really important. So the horse knows that this is a response to having stopped. I would then ride the horse more forcefully to the fence the second time around. And this would only be a very small fence. The horse jumps the fence. I'm with it in balance with the horse. The horse gets a good experience, and it's beginning to trust me. And then I repeat and repeat, and the horse improves and improves. And then it's got super confidence. And I have the experience of exactly that scenario, and then taking it to a show the very next day, winning 2 classes with the horse. And just the horse had lost confidence in the rider. And then you could put the normal rider back on. And because the horse wasn't expecting a bad experience, and you gave the rider instruction about how to ride the horse, then the whole problem was overcome. But if the horse stops with a better rider repeatedly, then I would begin to say, why? What is the underlying problem? Is it because the horse doesn't want to land on its feet because its feet are sore? And you can have sore feet without the horse showing overt lameness. Likewise, a good rider riding on the flat may be able to make the horse straighter with a more even rein tension. They may be able to make the horse do a shoulder in, but the horse still doesn't do it absolutely correctly. You put the normal rider back on, and it cannot be recreated, despite you coaching the rider as to what to do. And I think in that scenario, you have to think there must be a reason. And at the same time, I'm also looking at its behaviors. We've talked about the Ridden Horse Pain Ethogram before, and this is a scenario when I think truly it helps us to differentiate between a training or rider-related problem and an underlying pain-related problem. Because I think that with a rider or training problem, the horse may show some conflict behaviors, so it doesn't understand, so it responds by showing, say, 4 behaviors of the Ridden Horse Pain Ethogram, but it never shows 8. If there are 8 or more of the behaviors, then that tells us that there's underlying musculoskeletal pain. And that's a joy of the ethogram, I think, that it is a good way of distinguishing between pain-related problems and unpain-related problems. Because if you look carefully at the horse with the pain-related problems, even though the trainer may be able to make it do the movements, it's still going to show potentially the same behaviors or slightly different behaviors because if they've managed to crank the horse's head and neck down, the horse may actually find that rather uncomfortable and may then start opening its mouth or tilting its head when it wasn't doing those before. So the actual behaviors the horse is showing may change, but you can't obliterate the overall number of behaviors if there is underlying pain.
Mm-hmm.
But it's always going to be a process of elimination. Now, I'm not suggesting it's always easy.
Right.
And so, for example, you have a horse that's learning piaffe. Piaffe is very biomechanically demanding, I think. And it's difficult to teach the horse to do more than a few steps at a time. And it gets a bit confused to begin with, and it might swish its tail. It might put its ears back. Its front of the head may go behind the vertical because it's finding it difficult to be properly balanced. And in those early stages of piaffe, I think it can be very difficult to say, is this training? Is the rider not applying the cues appropriately? Or is the horse physically finding this uncomfortable?
Mm-hmm.
Or is the horse getting tired? There's often a tendency to try and repeat movements too much. And we know that horses learn better if they do a couple of repetitions and then you leave it. They can consolidate learning by not doing it anymore, which may seem painful to some people, but we know that's the case.
Yeah, I think a lot of horse people don't know that. I think a lot of us are taught to drill things over and over again to confirm them, and that's something I've learned from watching Megan train other species where they do very short sessions. They don't do 40-minute lessons with other animals. They do maybe 2 minutes or 5 minutes at the most, and they do a couple repetitions and move on. And I'm very sensitive to that now, having seen that, how well that works, that they do learn in just a couple repetitions and then being given time to think about it.
Yeah, I have a friend, Connie Colfax, who specializes in retraining difficult horses. And her sessions are very, very short, 5 minutes perhaps. Then she puts the horse away. She may come back to it several hours later, another 5 minutes, put it away, come back again, another 5 minutes. And the progression that you see is incredibly fast.
Yes.
And it's truly amazing when you've witnessed it, I think.
It really is. And it's such a hard thing, I think, for horse people to relearn that. For one thing, we're usually not at the barn all day unless we're a professional. And so we want to get all the training in all at once. But also it's just a cultural norm that we drill things over and over again. We have to do everything the same, both directions and do them over and over again. And it really is a great point that that's not how they learn best.
Yeah.
And I want to just circle back to something you said, which I think is so important to emphasize about the 24 behaviors ethogram. I think if people rewatch the film that we made a couple years ago on the 24 behaviors, you see the course of a whole lameness exam being done with Galena under saddle, and you comment about how much easier it is for Lauren to be correct in her riding over the course of the nerve blocks where the horse gets sounder. And I feel like that is one of the best illustrations I've ever seen of that. So I encourage people to go back and watch that section of the film if they're trying to understand that. And then also understanding the role of stress, not just with different riders, but in different contexts. I know I had a horse that was quote unquote fine at home, but when we would go to shows, he would flip flying changes that I didn't ask for, and then he started bucking a little bit, and it really undermined my confidence because I thought I just wasn't good under pressure. It turned out that he had enteritis and ended up colicking, but it was months and months before we got that diagnosis. And when I think back to that time, if I had the ethogram at that time, I don't think he would have been fine at home. I think it would have been very, very clear that when he started having issues 6 months or a year before he got sick, that those signs absolutely were there. I just didn't have those tools back then. And so it's so important that we now have that ability to track how our horses are feeling and notice those subtle signs early that we can then, at the very least be aware of, and at best address and make improvements. And it is so much easier to fix those kinds of things when you spot them early, which is really the whole message of using the ethogram.
I think having had the opportunity not only to ride horses before and after nerve blocks, but also to appreciate what owners have said, they frequently will say, gosh, the horse has never gone like this before. I've never had such responsiveness to the cues. And they are often absolutely amazed that their horse can perform so well just by doing nerve blocks and removing their discomfort. And I think that if you've got problems, don't ignore those problems with riding. Rideability, I think, is a lovely word in terms of saying the horse should be trying to do what we're asking it to do. Horses are probably far too stoic for their own good, which is something that they have developed because they are prey animals and they want to disguise their discomfort. They don't want the predator to come and eat them. And we have to remember that, how the horses have evolved. And we have to remember that those conventions that we have, naughty horses, lazy horses, is something that we need to throw out of the window now. We know better than that now. And it's time to move on.
Absolutely. So I think we've sort of covered this, but just to summarize, what would you recommend that people do when they notice a change or are trying to sort of peel apart the layers of what's going on and determine what's rider and what's horse?
Well, I think you can go through this stepwise. If you have a very good body worker who is themselves an equestrian and understands horses, those people are very good at being able to reinforce your instinctive feeling that something is not right. And they may find abnormal muscle tension, for example, behind the saddle. They may resolve that, but when they come back next week, that's returned. So that's consolidation that something's not right. Because if the manual therapist's work does not result in a lasting response, that reinforces that something is not right. And I think that then you need to seek the advice of a veterinarian, but a veterinarian who has some knowledge of horses' movement and how they should work under saddle. Because some of these horses are not going to show conventional lameness in hand. And so it's really, really important that when the horse is evaluated by a veterinarian, that it is by a veterinarian who's prepared to look at the horse not only in hand and on the lunge, but also ridden. It may be that the horse shows overt lameness when it's evaluated either in hand or on the lunge, and that can be investigated further by the use of nerve blocks. But some of these horses will only show their problems when they're ridden, so it is important that the horse is evaluated ridden, and that the investigation proceeds by asking, where is the source of pain? Because only when we know where the pain is coming from can we make accurate diagnoses. There's no good going on a fishing imaging exercise. It's no good just radiographing the feet and the fetlocks, for example, because you can have pain without any X-ray abnormalities. Equally, you can have the presence of X-ray abnormalities that are not currently causing any pain. So we need to know where the pain is coming from. And we need to know that when we remove that pain by the use of nerve blocks, that the horse is significantly improved in terms of its willingness to work and the correctness of its work, ideally under saddle. And then when we've identified the sources of pain, then we can use imaging to try to determine the causes of that pain. And then we can develop a treatment plan, and a management plan. Sounds easy. It's not always easy.
It's not easy, yeah. And I think it emphasizes the importance of training ourselves, but particularly also we need more vets trained in identifying these signs of non-overt lameness, particularly under saddle, because I think that's the future that we'd all like to see, is that, if you have a horse that has some of these rideability issues, you can call a vet and say, I would like to investigate this, and the vet be confident that they're going to be able to identify where the pain is coming from through observing the horse under saddle and seeing these more subtle signs rather than a head bob or a short stride. So that's what we're working on. Okay, I think that we covered a lot there. I don't know that we had any questions. Megan, do we have any questions?
I don't see any questions on either of the Facebook threads, and sometimes we don't see those till afterwards. So again, feel free to post here and we'll respond to them and have Dr. Sue take a look if we're able to. Mm-hmm. I am going to go ahead and screen share one more time to sort of take a look at what's coming up. So our next live with Dr. Sue Dyson will be on Thursday, June 13th. So coming up pretty quick around the corner here. And we've talked about a little bit before. We have some resources available on our websites, but Dr. Dyson has referred to issues being able to be noticed during tacking up and mounting. So we're going to talk in more detail about that. So be sure to mark it down and check back with us. You can find a lot of our resources, and you can also donate to us if you like this work that we're doing with our lives with Dr. Sue. If you've been following our materials that we have available for you, we're always happy to accept donations because it helps pay for all these wonderful things that we like to give you, such as the mobile field guide. So we have a beautifully illustrated field guide that shows some of the details that are difficult to catch in photographs and video, and a Ridden Horse checklist, the Ridden Horse Pain Ethogram, that you can take with you that can work hand in hand with that mobile field guide. We also have additional behaviors checklist, which talks about some of the behaviors during tacking up and mounting that Dr. Dyson will be telling us more about at our next one. Ideas for helping to select a vet and how to provide the best history to help your vet be successful. And of course, Dr. Dyson has co-authored with Sue Palmer the book Harmonious Horsemanship, that details how to use the Ridden Horse Ethogram to optimize potential partnership and performance. So go ahead and check back in with you guys here. So yeah, thank you everyone for joining us, and thank you, Dr. Sue, as always, so generous with your time. And we will look forward to seeing everyone again on June 13th to talk about tacking up and mounting.